So President Trump and RFK, Dr. Marty Makary, Dr. Oz, all took to the Oval Office yesterday to say it was their most consequential Oval Office meeting and press conference yet, and that is to talk about the cause of autism. In the course of that speech that President Trump gave, he did talk about a lot of things, but the primary focus was acetaminophen, which he had trouble pronouncing, acetaminophen, whose most common brand is Tylenol. What do you think? Is Tylenol contributing to the rising incidences of autism?
So, well, I watched the entire press conference yesterday. I'll be honest, it was painful to watch. I was very frustrated watching it because I can tell you the administration's message on acetaminophen, commonly known as Tylenol, and its use in pregnancy, certainly well-intentioned, but the tone was paternalistic, and the reality is the message devolved into a mess of hyperbole with some factually incorrect statements. So, to be clear, the conversation with acetaminophen use in pregnancy and the potential link to autism spectrum disorders and ADHD or other neurodegenerative diseases in the newborn babies, this is not a new conversation. Because of this, there's already a warning with the use of Tylenol in pregnancy. There have been many observational studies, one of the bigger ones from Johns Hopkins in 2019 that looked at cord blood in the umbilical cord of babies born with autism, and there was a higher rate of the metabolites of acetaminophen in it. So this was a correlation saying, well, babies who had more of these metabolites in the cord blood had a higher risk of autism spectrum disorder. Now, why do pregnant women take acetaminophen or Tylenol? Well, for pain, but also for fever. It is well documented fever comes with a much higher risk of autism spectrum disorder and other neurodegenerative conditions. In fact, up to 3 times the risk of autism in women who have repeated high fevers in second and third trimesters. Because of this, they wanted to look at, well, is it the fever, the infection, the inflammation, or the Tylenol that's the association with autism spectrum disorders? So there's a huge study out of Sweden, 2024, 2.5 million kids. They showed that they did not believe that it was the Tylenol itself that was causing autism. However, Will, what I can tell you is when you have a lot of correlation studies like this, obviously you want to proceed with caution. The message from the White House should have been, do not use Tylenol. Don't grab Tylenol every chance you can during pregnancy. You want to use it sparingly. You want to use it under the guide of your medical professional because there are still this possible correlative risk. But the reality is they haven't shown causation. The problem I had, the president came out and just told women, tough it out. And that's a problem, not because I'm a sensitive woman and I don't like a man telling me to tough it out when it comes to pregnancy, but the reality is there are severe physiological changes that can happen during pregnancy. And I don't want women to be more afraid of a potential medication that can treat the high fever, that can treat some of these severe ailments that have a higher risk of autism linked with them if they don't treat it. So unfortunately, I think that the messaging came with a lot of confusion and fear, and I think it brought us farther away from public trust in this whole environment than we started with.
The president also brought up, he brought up vaccines. And he said the following, if I remember correctly: we want to get the mercury out of vaccines, we want to get the aluminum out of vaccines, and we want to stage out vaccines. There's no reason to do them all at once, however many, and there's so many, by the way, that babies get at this point. But there's no point in doing it all at once. There's no upside. And he didn't say this is causing it, but he's like, this we think is a better step to go stage by stage and spread these vaccines out. Your thoughts?
So listen, we don't know. We can't point to all the causes of autism. There's obviously something going on. Yes, we've expanded the diagnostic criteria, and that's contributed to the increased numbers, but there are more children being born with some sort of neurodegenerative condition. You can't deny that. It has to be environment. It has to be something that's going on in the pregnant mother, whether it's her overall health, whether it's low folate acid in her diet, exposures to pesticides. All of these things have been casually linked to the rise in autism. When it comes to vaccines, we saw it with the COVID vaccines, they induce inflammation. That's what they're supposed to do. Inflammation itself can interrupt development in children. So does it make sense to maybe spread them out and try and decrease the inflammation? I think that all makes sense. I love hearing them talk about getting rid of some of the impurities in the vaccine.